also helping our accountable care organization from the routine colonoscopy checks, as colon cancer actually is one of the leading cause for death for people with these types of issues. The routine care is extremely important, and we are thankful that he's able to work with us. And we have our surgical PA. The life would be difficult without her. And Sydney has been with us, and she makes everyone's life a lot easier, including the patients. Now, our nutritionists, Amy, Fran, and Beth, they are permanent, so far full-time. One is three days a week. Pretty much this is what they do all day. And these ladies are excellent in what they do and keep our patients focused and committed to the program and stay compliant with everything that we do. Now, going back to our program, when we set up American Surgery Center, in these surgical entities, the biggest asset that you would have is having the expertise in the surgical field with your surgeons. So, and we were lucky enough, fortunate enough that we had the best surgeons in the nation in this specialty. And that makes it a lot easier for us to do what we are doing today. And because of that expertise, we were able to quickly obtain MBSAQIP accreditation for the Center of Excellence for Bariatric. And we got the double recognition from Blue Cross for Blue Distinction Center, and then Blue Distinction Center Plus a year later. And then also we are Aetna Institute of Quality, which is the Aetna's way of saying Bariatric Center of Excellence. And we also obtained that in the first 20 months of the program. We are extremely proud with what we do. Today, we are going to actually discuss something a little bit different than just the clinical issues. We are going to discuss digital health and how this changed our lives in the United States. And also this is true for around the world. Now, in case those who may not know anything about bariatric, and this is the first time you picked up one of our 200 videos that we did, you are qualified for a bariatric surgery if you are 18 and over and at least 100 pounds overweight, or your body mass index is 40 and over, or if it's 35 and over, then you need to have one of the underlying illnesses such as high blood pressure, diabetes, sleep apnea, and heart failure. So now the multidisciplinary approach is making everything possible for us these days, because the surgical field is, I mean, healthcare is different, but surgical field is even more different. Dr. Irgau, what I mean by that is, like if you're a primary care physician, you have a relationship with your patients. If you're a cardiologist, you have a long-term relationship with the patients, and they come to you only when they are sick, and then they may go back to their PCP. With the surgical interventions, then the relationship is kind of acute in a way. If you are getting your appendix or the gallbladder out, you may not see your surgeons ever again. Now, that's not the case for bariatric, and if you can kind of give the background on why bariatric is, it has to be the multidisciplinary approach and why it impacts our outcome. And I want to actually discuss the digital health part of this so that we can actually tell our patients what we expect when they come to the visit and before they come for the visit. And that's kind of like what I would like to achieve today.
Absolutely. Thank you for that wonderful setup, actually, Kemal, to introduce the subject. Essentially, as you correctly said, there is a big difference between the relationship of a bariatric surgeon and their patient and an acute care surgeon and their patient, right? As you correctly said, if a patient presents with an acute surgical problem, like their appendix is diseased or their gallbladder is diseased, they go to the surgeon evaluates them, decides that surgery is appropriate. they do the surgery, they recover from the surgery, and that is it pretty much, right? As you correctly say, they may not see their surgeon again. But why is that? Because they are dealing with an acute problem that has an acute treatment, and it resolves, it goes away. What a bariatric surgeon is dealing with or treating, Kemal, is a chronic disease, right? We are treating morbid obesity, right? Severe obesity. And as we have been saying many times in our sessions, morbid obesity is a disease and it's a chronic disease, right? So when a surgeon is really treating this disease, they are establishing a relationship with a patient that has a chronic disease. So by definition, their relationship has to be long-term, right? So we start with the evaluation of the patient. As you said correctly, not everybody who has a weight problem would qualify for bariatric surgery. Clearly, if a patient is about 20 pounds over where they need to be, surgery is not the answer for that. As you say, the person has to be at least 60, 70, 80, 90, 100 pounds or more over their ideally weight before they can consider bariatric surgery. And also, very often, when patients present for bariatric surgery, they will be way higher than that in terms of the weight that they have accumulated, right? In addition to that, the weight itself will have created many disease situations, whether it's diabetes, whether it's high blood pressure, whether it's heart disease, whether it's sleep apnea, many illnesses associated with obesity. So when the patient presents to the bariatric surgeon, they are presenting themselves not only with the weight issue, but also with a plethora of illnesses and diseases directly related to the weight. So yes, the surgeon has a surgical solution for that. Yes, the surgeon does give them an extremely powerful tool to induce rapid weight loss, right? Whether with sleeve gastrectomy, with the gastric bypass, with the duodenal switch, with the gastric band or the gastric balloon, right? These are all important tools that have a place in that treatment. But then we tell our patients that we're providing a tool, right? It's not a magic answer. It's not a magic answer that we give to them and then poof, the weight goes away and then they never worry about it. It's not. These surgeries are very powerful, but they are tools nevertheless. So the surgeon has to be in constant contact in the long term with the patient so that the patient does not struggle again. And the reason for that is because obesity doesn't happen by chance. Obesity doesn't happen because somebody doesn't have willpower. Obesity primarily happens because there is a biology that drives the body to be at a higher weight. And that is the person that we encounter that suffers. So that biology is being fought with the surgery, yes, but it has to be fought also, most importantly, with a long-term commitment to a way of living and to a way of making choices in their life when it comes to eating and also physical activity. And then there is the other aspect also, more importantly. Remember, Kemal, when we do, for instance, something like gastric bypass, we are making changes to the digestive tract that are so impactful that long-term there are consequences to those changes. Patients will have to stay compliant with their nutrition. They will have to be compliant with their multivitamin intake. We have to make sure we do blood tests on a regular basis so that they don't fall short of some important micronutrients. So the surgeon, a bariatric surgeon, must establish a long-term relationship with the patients. That is the major difference. And of course, the topic today is how does telehealth help in this situation? How does it fit in this situation? And that's obviously the great discussion that we're having now.
So with that, what I would like to actually ask you is, again, because we spend a lot of time together during the day to see how your patient flow is happening, what changed with us for the pandemic, because it was different. If you remember in the beginning of the pandemic, like people are like, oh, stop everything, stop the train, let's get out of it. We didn't. We said, no. Like we have to deal with chronic issues in the way that we do, not the way that hospitals, the way like my earlier session still has some impact on me. I apologize. Comes across rude, but this is a chronic issue, and it doesn't take a break when we have a pandemic.
Absolutely.
You don't get it's not like you don't get a heart attack anymore.
No,
Or because
absolutely. Absolutely.
you go to the hospital, your heart doesn't say that you have to stay home and not to, have an attack. Like that doesn't work. So what we actually early on discovered that. But then one of the challenges is, which became the greatest strength of today's CHRIAS and Surgery Center and United Medical ACO providers, is the telemedicine. Now, from our bariatric side, we had to implement a couple different things, different layers to make sure that patients are getting the support that they need, because they were not coming in to our offices now in the bariatric setting. Why this is more important? Because there are multiple appointments. So now it's not like one appointment next day. It's so interesting that many people wouldn't remember this. I'm not saying that people are getting gallbladder surgery for fun, but you don't need any qualifications. You just need some gallbladder related complications. We'll take it out on the same day or next day. And the complication out of gallbladder is nothing less than bariatric surgery. So, however, everything else we have to do from the patient standpoint is, we have multiple appointments. How are we going to go through these? The dietitian, the mental health, the other, specialties, the cardiology, pulmonary. So at a minimum, there was some stuff that needed to be in person, but we kept everything through telemedicine so that we can actually help them to decrease the burden of the patients in participation for multiple touch points. Now, it's not just us saying this. This is our ASMBS, yes. And then they're saying the same thing. So now, Dr. Irgau, from your side, tell us about what you have to do to increase the efficiency of the telemedicine. And then I have a couple of follow-up questions after that.
Absolutely, absolutely. So telemedicine has been really a very, very important addition to the way we practice medicine, simply because it allowed us to connect with our patients without having to be in the same place physically, right? For a patient to be in my office, right, they will have to rearrange the day considerably, because a lot of the time that they have to take to be in my office is the transport time, right? The back and forth. And that's not always easy. It's not always efficient. That's one very major issue. So by having the patients be where they are and me in the office and just do the connections through telehealth, the efficiency is incredible. The patients have a much, much better better time really rearranging their schedule to be able to go to their doctors. And sometimes in the past, patients may have missed appointments, may have rescheduled appointments just because it was not possible for them to be at my office at that predetermined time. So that is that. But then there are added layers to telemedicine that very often we don't think about, right? So one of them is that with telemedicine, the patient very often, they are in their own familiar environment, as opposed to being in this cold office where they are in that room with their doctor, right? If they are in their own place, in their own home, sometimes that creates a certain atmosphere of relaxation that really is beneficial for the interaction itself. It takes the tension of the interaction away to some extent, right? So there is that beneficial aspect to telehealth that very often we don't think about. It is, of course, important that that telehealth encounter is made with the privacy of the connection, assured. So the first thing I ask my patients, Kemal, when we connect through telehealth is I say, hey, Mrs. So-and-so, do you have adequate privacy where you are for us to talk freely about your health? That's the first question I ask them, right? And invariably they will say yes, because they will have made arrangements for them to have that private conversation, because that connection with their doctor is extremely private. It's extremely intimate, and it's important for patients to feel comfortable in that privacy. So that they have to assure before the connection is done. So what has telemedicine brought us is it brought comfort to the relationship, but also it brought a lot of efficiency to the relationship. So there is less chance for appointments to be canceled when we are doing it through telehealth. Now, as you said earlier on correctly, not all the encounters between a surgeon and a patient can be done through telehealth. Clearly, my most crucial and important encounter is the surgical encounter. That cannot be, of course, substituted with telehealth. And then there are other situations. For instance, if a patient has had a procedure and I'm doing a post-operative check, everything is going well, there is no problem. Very often, they may be able to direct their camera to the area of the surgery, and I could see with excellent quality, I could see that they are healing very well, and I can reassure them. But sometimes I may want to see the patients in the office to be able to assess how they are healing, how they are recovering from that point of view, in which case the in-person encounter has to be and is always an available option as well.
Sure. Dr. Irgau, as you were explaining this, one of the reasons that I wanted to have this session is because we do have some issues with the adaptation of this from our patients. So, and I know that our patients are watching these. So now the only thing that I lost my drawing board. What happened to it? Am I not? So like I had this little bar, Dr. Guy, I lost it. So I don't know where it went. So let me just stop this for a second because I point out a couple of things here. I lost it. Okay.
All right.
Now, let me actually just share the slide again. And oh, there we go. So like getting old is challenging. So I wasn't on the PowerPoint, so that's why it's lost. So, and we do this so many times now, so some simple stuff becomes challenging. All right, so now my drawing board is there. Okay, good. So now this is what I want us to kind of focus on, if you can please, our patients. So you can choose to call us, but good luck. Now you are going to say, what type of executive are you? The real one, the realistic one, because patient phone calls are not evenly distributed. We don't get 3 calls one call every 3 minutes. We get 25 calls in 1 minute. So therefore, there is no way that we'll be able to answer you right away. Now, but you can do 60% of the reasons that you are calling us, 65 actually, you can actually do it through our IQ Health portal. So this portal is your, access is power. So everything that you need to know, your appointments, your upcoming appointments, your scheduling a new appointment, making the telemedicine a pleasant experience, they're all available through IQ Health. So IQ Health is our hub for our patients. So what I mean is please make sure that you activate your IQ Health. Okay, so that should be, if you don't have an active portal, make sure you go through your spam folders and wherever, because it's an auto email that comes out as soon as we register you with your email addresses. So it's not like someone is going to forget, and it is going to be right on your phone. So in your fingertips, right here. So everything, not just the visit, everything that we have on you is there for you. So now this is a screenshot of telemedicine from this portal. Well, like you see, it's this e-visit, it says here. So then you don't have to go to some link that may not be safe. Now, federal government has given us some waivers for HIPAA-related issues with the telemedicine, but I don't want our patients and our providers to be exposed to any type of unsafe, unsecure connections, or because it's still, these things still can happen. So we want to keep your record safe. So when your privacy is important. So please, do activate your portal, and then by utilizing this guy here, then you can actually have this view from your phone, from your iPad, from your laptop. Now, when this came out, this issue, the telemedicine, for our patients, I'm going to just the benefit for our patients, Dr. Irgau and I, we are, people should maybe say these things for themselves, but we are visionary people, so we are not settling in any setting just because we are comfortable. If there's a change that needs to happen, he and I, we are first on the road. We just take it and run with it. And that's the same thing we did with telemedicine. So that kept our patients out of the hospitals, that kept them safe. We have the lowest hospitalizations in our ACO because of the telemedicine approach and adaptation of telemedicine happening so quickly. No one in the nation did it as quick as we did. Now, why I'm saying this is because after a couple of months, I decided to write an article, because we take and run with the changes, but we also know when there are issues, we have to deal with those issues. But we are not going to kill the good for perfection. Yep. So the perfection is the enemy of good. So you have to, if it's at the good level, we are not going to try to kill it for perfection. But we are going to improve it. So as soon as we got out of that 3 months, maybe 2 or 3 months, I said, okay, because it was happening just like this meeting that we do today. This is a Zoom meeting, and certain protocols that I wanted my office to follow when they were dealing with business issues. So, I always have my jacket on when I have these types of meetings, and it's also true for internal meetings. So we have proper camera angle, proper setup, proper hardware, proper privacy. Imagine if your doctor is talking to you when you are you want to do this at the mall, right? So when your doctor is also the next store in the mall, so you are in the Samsung store and then he's in the Apple store. What are you going to do? Are you going to be happy if you discuss your issues with other people around us, right? So certain protocols they're not our enemies. They are going to keep us out of trouble, and we are protecting your interests. So then what I did, do's and don'ts for when I was doing it, of course, I'm a businessman. At the same time, I'm in healthcare. So I have to do this from patient and from the business standpoint. So here's the business, here's the patient. You may be a patient who may be using the Zoom and other video channels in your business. You should really read this. So, but talk to your coordinator, scheduler in advance, and be open about your concerns. Check with your insurance if the telemedicine is covered. So this is not an issue. Many of these insurances are already on board. Test your tech before your appointment. So if this is your first time you are using the application, proactive approach always is going to help you. Be ready to show and tell. So it shouldn't be because remember, patients do actually benefit from this encounter by saving several hours. Because when you were to come to our office, you had to take at least half a day off because of the travel time. Because of if you were running late, then you were going to wait in the waiting room. Now we take all those out. Well, in return, we should have a decent setting. As we are trying really hard to do it on our side, we expect that from our patients. So turn off other applications and other videos. So your phone, your devices can handle only so many stuff. When you are running way too many things together, that's not going to help. So then make sure that you do that. Here's our the don'ts. Is it our balances? Okay, it says balances. Okay, so for don'ts of this for patients is participate in a consult while distracted. So we have, Dr. How many times you have a patient who was driving?
A few times.
Okay.
Yeah, absolutely. And that's actually not safe either. Not only it's not, they cannot focus on the consultation, but also it's not safe. So if I do see a patient in their car, the first thing I ask them is to make sure they are parked safely somewhere where they can talk to me. And I tell them to take their time to go, if they're not parked, to go park. And then once they're done with that, then we can continue the conversation. Obviously, that's those issues of safety are very, very important. And I know sometimes patients actually, they may be at work at the time of the consultation and they may take a break for the consultation and they choose to be in their car because that gives them the maximum privacy, for them to conduct the communication. And that's absolutely understandable and it's okay, but it is clearly important that they are parked when they do that.
So, and then again, the only reason we are talking about this is because sometimes when it doesn't work, we are like, oh my God, let's not do this. So, Dr. I'm going to tell you something funny. I know my mom is watching, but she doesn't speak English, so we are safe. So, as an international student 22 years ago, when I need to communicate with the family, I would be on the regular phone dial, and then this is 1999, end of 98. So, do you remember the phone card like that we would buy for international calls because that was the way that we could afford? Yeah. And I remember $500, $600, $700 a month just on the international calls, 1 or 1.5 hour a week. So now, then from that time, then come now with FaceTime, free with your service, right? So like you actually can see the person. Now, mom is at a point where she can't talk to me anymore if she doesn't see me. Oh, did you get a call? I'm like, I can still hear you. The connection is not so great. The quality is not great. She starts complaining about it. Well, it's in a way it's funny, but when the technology is available at this level to us, we have to take certain precautions to make sure that quality. Because what I'm trying to say is that mom expects certain quality from that video call. She doesn't care what was happening 20 years ago. She's complaining about this free call, FaceTime. She's like, show me your dog, show me this, show me that. Like, I'm like, well, I used to do work when I was on the phone with her, not anymore, because she wants to have eye contact. If you are not looking at her, she gets upset. So that's what we expect from our patients. Mm-hmm. So what mom is expecting from me is what we are expecting from our patients. We'll do our part. I'm not saying that this is just from the patient side, but your patient portal is extremely important for us. And then using the videos through your portal is even more important. So last week, we discussed our patient satisfaction. Although we demand stuff from our patients are extremely happy. 99.2% didn't change. Now, I have a couple new ones, Dr. Irgau. I know I shared one of them with you. This is something from this week. The level of care for me was extraordinary. The doctors, nurse, and staff were very friendly, answering all of my questions. So here's another one, best staff ever. Thank you so much. And then this is so interesting. We have the patient name. So sorry. But I think he was fine. So that person, let me see if I can actually, I apologize for that. Let me just, because that was a really good email. So this is why I say we are trying to protect you because we don't want to be visible. So let's see. Now, just because we made this mistake, are we going to shut down the live sessions? No. I mean, that's kind of like what we are trying to say here, right? So these things will happen and we'll fix it in 2 seconds now. And fixed. And slideshow, here it is. All right, so this is maybe I got a little bit excited when I see something so nice. So this person didn't get the survey from me yet, but he was bugging couple of our employees there to get my email because he wanted to share his experience with our surgery center. And, we don't say maybe enough or frequent enough, but I really do appreciate all of the work that our nurses, our staff at American Surgery Center does do for us and for our patients. So when I got this last night, I was extremely happy. So I really want to thank everyone making this. Rika, she's amazing, very, very professional, and was always supporting while needed to any questions. Now, this is the care coordination piece where we have to keep our patients' hand while they're going through the process. And then he goes and mentioned our nurses, Wendy, and also thanking the doctor and the surgeon. So, and he's saying that he didn't feel like he had a surgery day after. And that's what we are actually trying to tell you guys here. So, and that's what we do. Mm-hmm. So if we can actually make you part of this experience and help you, that's our goal. While we are doing this, we want to do it in the best quality setting with the least expensive way. And that's the setup that we have for you in American Surgery Center with CHRIAS and the partnership with United Medical ACO. Now we have some events coming up. Like now you know that these are Bariatric Fridays on Friday at 1 p.m. CHRIAS weight loss seminars, second and fourth Tuesday, 6 p.m. And UMACO recent updates, this was today at 12 noon, and that's every week. And then Wednesday wellness webinar, second and fourth Wednesdays, 7 p.m. The only thing that is, if you are a patient of us who had a surgery from us, we also have a bariatric support group on Tuesday, first Tuesday of the month, but that's an exclusive event. So you would be getting an email only if you actually had the surgery from us. These are the stuff from our channels, but most people, they already know what's going on here. So Dr. Irgau, from my side, I was trying to kind of give some instructions for our patients, because I know if things don't go through right, then you are not happy and our other surgeons are not happy. Anything that you would like to tell our patients before we close?
Absolutely. So this is an important topic, Kemal. Absolutely. Medicine is all about connection, right? It's a connection between the caregiver and the patient. Now, telehealth really increases the availability of that connection. It makes it easier, it makes it efficient, right? I can give you an example of how telemedicine really is transforming the quality of the care that we give, right? I got a call the other day from a nurse visiting a patient of ours that patient was struggling with her fluid intake, okay, after a complex procedure, and she was home. So, I could have called that patient and talked to her on the phone like we did in the past, but I chose to initiate a telehealth connection with her, right? I asked my office to schedule her telehealth impromptu. They did, and I was able to see that patient. And immediately as I saw her, I knew she needed to go back to the hospital to get some IV hydration. I could tell just by looking at her, right? So that connection saved the patient and myself really a lot of time for giving the appropriate care to that patient immediately. This was not available before. So telehealth really is transforming, and it is important for all of us really to embrace it, improve it, because like anything else, the more you use it, the better we get at it, not just from our side, but also from the patient's side. And of course, it's never going to be a complete replacement to that physical contact, to that touch that is also needed, particularly from a surgery point of view, because so very often we really have to do a physical examination for us to be able to determine beyond just the inspection. We need something called palpation, where we have to touch with our hands certain parts of the body for us to make the correct diagnosis, right? So that is never going to be replaced with telehealth. But telehealth is taking a really a long way really to make this connection much more efficient, much more available for us. And that means also the care we give is just getting better.
So, just to add to what you just said, one of the reasons with the telemedicine it allows us to spread out our patients for those who needs to be seen in person.
Yes.
So it's one of those have to be in person, but the rest can be on telemedicine.
Absolutely.
That allows us to do what we need to do for those patients who should be seen in the office. And
Absolutely. Absolutely.
So we'll communicate these more. Our office is going to send you some templated text messages, portal messages. I was hoping with this video, part of it can be sent to you guys as well. Then you know from us, you hear it from us why this is important. If I were you, I wouldn't call our office for anything other than if you're a new patient. You know why? Because there's your portal. Go to your phone. You are in the bathroom and you want to cancel your appointment, you do it. You want to get a new appointment, you do it through there. You need your lab result, you do it from your phone. I mean, I'm pretty productive when I'm in the bathroom, so it's one of those utilizing other applications. Well, thank you so much for being with us. Dr. Irgau, thank you for joining me.
Thank you, Kemal. Have a good weekend, everyone.